I'm going to percuss your chest and check for any signs of retrosternal thyroidosis. Okay, I'm not noting any paleness in your palmar creases, which are the folds, the creases of your palms. That's usually associated with iron deficiency again. I'm also not seeing any signs of palmar erythema or red palms, usually known as red palms as well. That is associated with hypothyroidism, thyroid toxicosis, so an overproduction of the thyroid hormone in your blood supply, and various liver diseases such as cirrhosis, which is very good. Hi, my name is Dr. Lux and I'll be doing your medical exam today.
Happy to see you again, Dr. Lux.
Welcome back, Maria. Very nice seeing you. I'll be doing your thyroid examination. Okay, so tell me a little bit about what brings you in and why you want your thyroid checked out.
Lately, I feel a little tired, more than usual.
Okay.
And I thought it's better to have a thyroid exam.
Very good. I can definitely do that for you. A very in-depth thyroid examination, and we'll get to the bottom of your tiredness. Okay, before we begin, please confirm with me your date of birth.
February 21st, 1963.
Okay, so I definitely have the right chart. Let me ask you a couple of questions. Have you noticed any recent weight loss?
No.
Okay. Any major changes with your body? Any unexplained pain in any areas of your body?
No.
Okay. Do you have a history of thyroid problems, either with you or with anybody in your family?
No.
Okay. So no hypo or hyperthyroidism?
No.
Any recent unexplained fatigue?
Yes.
Yeah, you mentioned that already. Okay, on a scale of 1 to 10, where 10 is maybe the tired you've ever been, the most tired you've ever been in your life?
7, 8.
7 or an 8, okay. So that's significant enough for an in-depth examination, so I'm happy you came in today. Any recent weakness in your body, muscle cramps, tremor, anything wrong? Okay. Sounds good. All right, Mary, I'll be more than happy to get you checked out today and try to get to the bottom of your unexplained tiredness. Okay, so I'll just sanitize my hands and then we can begin the examination. Are you in any pain right now?
No.
Okay. I'll just put on my gloves. And I'll start off with an examination of your hands and your nails. Then I will check out your hair, your head, and your face. Usually with thyroid problems, there are external indications of either hypo or hyperthyroidism. And then I'll palpate your thyroid and do an in-depth examination of your thyroid gland.
You have such beautiful flowers here.
Yes, I have
gorgeous.
Beautiful real roses from a company called Rose Forever. They are treated with special proprietary oils and they last up to 1 year.
Wow.
Which is amazing.
Yes. They are gorgeous.
Okay, let's begin by please taking out your palms for me. Okay, I'm not seeing any tremor. Let me make sure by placing this sheet of paper on your hands, Okay, no tremor noted. If there was any tremor associated with the dysfunction of the thyroid, we would be seeing a very high amplitude here. Excellent. Okay, continue holding your palms out for me. Going to examine your nails. Okay, no signs of coloonychia or spoon shaping of the nails, usually associated with anemia, hypothyroidism, and overall iron deficiency. That's very good. Okay, I'm also not seeing any nail splitting or brittle nails, which are associated with both hypo and hyperthyroidism. Let me just feel your hands. I'm not noting any excessive sweating, normal temperature on both of your hands. No redness, no scaling or dry patches of the skin. Your fingers are not swollen, which may be an indication of thyroid acropathy. Okay, very good. Palms up. Continue holding them like this for me. Okay, I'm not noting any paleness in your palmar creases, which are the folds, the creases of your palms. That's usually associated with iron deficiency again. I'm also not seeing any signs of palmar erythema or red palms, usually known as red palms as well. That is associated with hypothyroidism, thyroid toxicosis, so an overproduction of the thyroid hormone in your blood supply, and various liver diseases such as cirrhosis, which is very good. Great. Okay. Turn your hands the other way for me. I'm going to check your capillary refills. Okay, capillary refills within 2 seconds, which is normal. Can you squeeze my hands really tight? Very good. Okay, normal hand examination. Okay, next up, put your hands together like this in a prayer and press down on your wrists. Do you feel any pain? No? Okay. How about we do this? Okay, very good. Next up, bring your hands together in a heart shape and touch your nails from your index finger. Okay, I'm going to check for the presence of the Schamroth window. I can definitely see it in between your nails. That is a test to check for nail clubbing, which is a condition usually seen in patients with hypothyroidism and that have Graves' disease. So I was not able to see any indication of clubbing in your nails. Let me make a note of those observations. So no signs of coloonychia or spoon shaping of the nails. No nail splitting or clubbing. No brittle nails. No excess sweating, normal temperature. Palmar creases not pale. No signs of palmar erythema. And no clubbing. Schamroth with the window presence noted. Very good. I'm going to check your pulse in your wrists as well as your brachial artery. I'll start with your wrists first. I'll use my index fingers and feel your pulse. I'll be checking for a radial delay from a cardiology perspective. Okay, your pulse is synchronized in both of your arms, about 82 beats per minute, which is normal. I'm not noting any signs of tachycardia. That would usually be associated with hyperthyroidism or bradycardia, which is a pulse of less than 80 beats per minute, which would be a sign of hypothyroidism. Also, I'm feeling a very steady rhythm on your pulse, 1, 2, 1, 2, 1, 2, which is a sign that your heart is functioning normally. There is no sign of arrhythmia or atrial fibrillation, which could be an indication of hypothyroidism. That's very good. Okay, next up I'm going to check your pulse in your brachial artery, which is the main artery that supplies blood to the rest of your body, and I'll be looking to note the character of the pulse. Okay, I'm feeling a normal pulse character. I'm not feeling a pounding, heavy pulse, hyperdynamic that could be associated with hyperthyroidism. And also your pulse is not weak or thready, which could be a sign of hypothyroidism. That's very good. Thank you. Next up, I would like to take your blood pressure. Any arm preference? This one is good. Okay. It doesn't really matter as long as your legs are elevated above the ground. Okay, can you please hold this for me? I'm going to close the lock here. And just relax. You can breathe normally. Okay, that was 120/70, a normal blood pressure. Thank you. Let me just take a couple of quick notes. So normal pulse rate, 82 beats per minute, synchronized, normal rhythm, and normal pulse character at the brachial artery. 125/70 blood pressure, all normal. Great. Okay, next up I'd like to do a face, hair, eyes, mouth inspection, and then we'll move our way down to your neck, lymph nodes, and thyroid gland. Do you feel any pain right now? No signs of any facial droopiness or swelling. Going to percuss. Let me know if you feel any pain. No redness, no dryness or scaling. Okay. Then we quickly inspect the skin on your face as well. Normal color. Looks like you're well hydrated. Face is normally perfused. No signs of any concern. Okay. Very good. Okay, next up I'm going to take a look at your hair more closely. Have you noticed any unexplained hair loss or anything wrong with your hair lately? No? Okay. I'm not noting any patches of hair loss. Hair follicle looks healthy. No signs of any hair thinning. Fine hair or thinning hair can be an indication of hyperthyroidism. And your hair is also not waxy, which could be a sign of hypothyroidism. So no waxy or thinning brittle hair. Okay, let me take a look on this side as well. I'm noting the same observations. Your hair is not fine or brittle. No patches of hair loss. And no signs of any waxiness or excess oiliness in your hair. Excellent. So no signs of any hypo or hyperthyroidism can be noted after an examination of your hair. So just by looking at your face, your eyebrows look normal. Usually in patients with hypothyroidism, we can see a loss of the outer third part of the eyebrow. So I'm not noting that on you, which is a very good sign. Okay. Your eyes also look normal in normal light condition. Have you noticed any tenderness or any problems with your eyes? Okay. Is it okay if I palpate them?
Yes.
Okay, close your eyes for me. I'm going to gently press down on your eyelids. I'm not noting any nodules or any signs of eye puffiness. Look up for me. I'm going to gently press down on your eyes and take a look inside. No signs of any anemia or iron deficiency. No signs of any jaundice or yellowing of the eyes. Okay, very good. Next up, I'd like to check your lid lag. Usually in patients with hyperthyroidism, we can see one eyelid lagging the other one. So can you please look up here and then follow the pen. Try not to move your head. Let's try it again. Okay, how about if I do it faster? Very good. No lid lag is noted. Okay, next up I'd like to check your binocular vision. Usually when there are thyroid problems, we can encounter patients that have a loss in their binocular vision. So can you please follow the light? Try not to move your head, just follow the light. Okay, do you note any double vision at the periphery?
No.
No? Very good. So I'm seeing your eyes move in the full extent of the allowed range. Any double vision right here?
No.
No? Very good. Okay, so no loss of binocular vision is noted. Okay, so far so good. Let me take a couple of notes right here. So normal skin color on your face, No signs of hair thinning or waxiness of the hair. Full eyebrows. Eyes are normal, no puffiness. Lid lag test is a pass, and no loss of binocular vision noted. Okay. Very good, Maria. Next up, I'd like to check your mouth. Can you please stick out the tongue for me? I'm going to inspect it. Okay, normal tongue color. No sign of anemia or iron deficiency. Otherwise, your tongue would be pale, extra smooth, or maybe dry. Okay, next up, I'd like to check your mouth. Can you please stick out your tongue for me? Okay, your tongue is normal color, not swollen, pale, or extra smooth, which could be a sign of anemia, so that looks okay. Let's see the inside of your mouth as well. Can you stick out your tongue for me one more time? Say ah. Okay, I'm not seeing any ulcers or any cankers inside your mouth, and the back of your throat is not swollen, which is very good. Okay, Maria, next up, I like to focus on your chest, your neck, and your thyroid gland and examine it.
Okay.
Just above your clavicles, I'm not noting any enlargement of the lymph nodes. No lymph node enlargement noted. Okay, I'm going to gently palpate the thyroid from this position. Okay, next up I'd like to palpate the thyroid from the back as well. No lymph node enlargement noted. Any pain when I palpate on your thyroid?
No.
Okay, very good. If there was any inflammation with your thyroid, it would usually be accompanied by pain. So I'm not noting any masses, no lumps or bumps, no sign of any palpable murmurs or thrills. And the thyroid gland is barely palpable, which is what we want it to be like.
Great.
Okay. Very good. That's very good. I was not able to feel any, abnormalities with your thyroid gland. I would like you to please lay down so I can check for retrosternal thyroid, which is a thyroid that can potentially move down towards your chest. Okay, please lay down. Okay, just relax for me. I'm going to percuss your chest and check for any signs of retrosternal thyroidosis. Excellent resonant sounds. Not noting any indication of retrosternal goiter. Very good. Okay, since you're already lying down like this, I'm going to listen to the thyroid gland with my stethoscope. The thyroid has one of the richest supplies of blood of any organ in the body. So I will auscultate it with my stethoscope, and I'll be listening for any whooshing sounds, any sounds that may indicate thyroid bruit being present. Take a deep breath in and hold it for me. Excellent. No whooshing sounds, no sign of any thyroid bruit. You can exhale. Okay, one more time, deep breath in. And exhale. Excellent. Okay, you can come back up. Okay, Maria, very good. Let me just take a couple of notes of my observations. So no lumps or bumps on your thyroid gland, no masses, mostly impalpable. Percussion gave us excellent resonant sound, so no sign of any retrosternal thyroid happening. Excellent. Okay, next up I'd like to take a look at the thyroid while it is moving. So first up, I will check for presence of lingular thyroid, which is a thyroid that can be seen in the back of your throat if it's enlarged. So open your mouth wide for me, stick out your tongue, and let me take a deep look inside. No, I'm not able to note it, which is very good. So no signs of lingular thyroid. Next up, I would like you to please take a sip of water so I can take a look at your thyroid while you're swallowing. So take one small sip and hold it for me, don't swallow it. And swallow. Excellent. So I was able to see the thyroid gland moving up and down, which is what we wanted to see in a healthy thyroid. Take another sip of water for me and hold it again. And I will place my hand on your thyroid gland and swallow. Excellent. I was able to note an up and down normal movement of the thyroid gland. Next up, I'd also like to take a couple of measurements of your thyroid gland and your neck so that we can have a reference to compare against in your future examinations. Okay, 28.579. 28.947. 42.957.8. One last. 24.57. Excellent. Okay, finally, I have here a medical hammer, and I would like to check your reflexes in your elbows, your wrists, your knees, and your ankles. Okay, just relax for me. That's very good. Very good. Very good. Very well. Right, Maria. So normal reflexes in your biceps, your wrists, your knees and your ankles. One final thing I'd like to do is to examine your feet and check for any signs of edema or swelling, which could be associated with hypothyroidism. Lay down for me one more time. Okay. Is it okay if I lift the sleeve of your pants a little bit up? Okay. And this one as well. Let me do a light palpation. I'm going to press down on your ankle, on the tibia, not noting any signs of edema. Which is very good. Normal leg temperature. No excess sweating noted. Normal capillary refill within 2 seconds. Do you feel any pain when I press down on your plantar region? Okay, let me take a look at this one as well. Pressing down on your tibia. No sign of any swelling or edema. So no concern of hypothyroidism. Do you feel any pain right now?
No.
Okay. Normal leg temperature as well. Normal capillary refill within 3 seconds. No excess sweating noted. Any pain when I press down on your plantar region?
No.
Okay. So no signs of any concern. You can come back up. Okay, Maria, it was a pleasure examining you today. I was not able to note any signs of any hypo or hyperthyroidism, so nothing wrong with your thyroid. I would like to check your heart a little bit more in depth and make sure that there are no signs of arrhythmia. So I'm going to ask you to please take an EKG, an electrocardiogram. And I'm also going to ask you to take a full blood panels, including a thyroid function test, so we can examine your thyroid biochemically as well as clinically, which is what we did today. And we can review the results of those tests together and take it from there. So far, no signs of concern.
Thank you so much.
Okay, very nice seeing you again.